Breast cancer has touched many of our lives, whether personally or through a loved one or friend. And as you probably know, October has been set aside as Breast Cancer Awareness Month.
Joining us today to discuss breast health are Nicole Lamb and Patty Ackerman from the Pocatello Women's Health Clinic. Thank you so much for joining us today. So tell us a little bit about just have we seen a rise, have we seen a decline in breast cancer, and can we attribute that to better self-screenings?
You know, I think the rates have stayed
Pretty much the same.
the same. Mm-hmm.
Okay, so we hear a lot that we should be doing self-examinations each month. Are people doing those more often than they used to? What's your insight into that?
Mm-hmm. Well, my take on it is they used to have detailed instructions of how to do it, what time of the month to do it. So a lot of people couldn't remember that, and so they wouldn't do it. So now we've found that a lot of lumps are found by people themselves or their family members, partners. So just getting to know your own body, when something has changed, that's when to come in. You know, not worrying about doing it at this
a certain
time of the month and a certain,
Okay, so it's more important just to do it.
Yeah, just to get to know your body and so you would know if something was different. So it's easiest in the shower. You're already there, making sure you're just doing a exam in the shower and getting to know your breasts, so if something changes, you're aware of it.
And I understand with the self-exams that a lot of people don't think about it, but the armpit is actually a place where a lot of times people will find lumps, and not to forget that area as well. Is that correct?
that's correct. Part of the breast tissue goes up the tail into the...
So at what point should women go in for mammograms? Is there a certain age? If you've already passed that age, is it too late? Should you just get started?
So they should start at 40
Okay.
and then go every year after that.
So it is every year starting at 40. I know there are a year or so ago, there were all these different recommendations that came out. And I know people are confused by that. What do you recommend? So it is every year.
So the U.S. government has said 50, is that right? But American Cancer Society, the Radiology Society, American College of Gynecology, all say 40.
Okay.
So they catch a lot more.
Okay. So just be safe. Better safe than sorry, and go ahead and do them more often and starting earlier.
Yes.
What do you know about genetic exams for breast cancer? Is this something that we're seeing that is hereditary, that's being passed down?
So 5 to 10% of breast cancers are hereditary, and we do have a screening test that you can do in our clinic. It's just a simple scope mouthwash that checks your DNA. Insurances pay for it if you qualify, if you have the family history. So it's one family member that had breast cancer at less than age 50 or 40.
50.
If you have two family members that have cancer, or a combination of the ovarian breast cancer. So there's different criteria.
Okay.
And insurances are paying for some of those.
Okay, so then you can see if you're genetically predisposed to it. Then.
Yes.
Very good. Well, I know that a lot of women have questions about this. If anybody would like to contact you to find out more information, how do they get a hold of you?
232-6100.
Very good.
Okay, call and make an appointment.
That's right.
All right. Thank you so much for coming on the show today.
Thank you.
And when we come back, we're going to have your questions, or your answers to our question of the day.